Okay, so the visual disturbance are secondary pressure behind the eyes. Such a hard pressure behind you, it causes you to hard blink several times. You can't hold on to eye contact. Gaze instability is something that Dr. Hauser called it. You were born 3 months premature, and I think it has to do with your anatomy. Your anatomy is a little unique because you were born 3 months premature. You got this screwy vision that is hard to define. Okay, this is what we found. Now this is here is the typical scan that you've been getting, and you've been told that you do not have a jugular vein on your left side. Some people do not, that's true. However, you do have a jugular vein on the left side, you just can't see it. We did 3 venous phases on you to show it in all its glory. So it's almost like you have a co-dominant system. The right vein is a little more dominant here. I'll bring that here. So this was the first venous phase that we did. You can see that after we wait a little bit, the contrast does get in there. You do have a left jugular vein, and with left and right head rotation, we show it to open up, and we'll show that. So this is the jugular vein with left head rotation. You can see how the styloid is, of course, displacing it and shutting it down. All right, so that's, and then we did a right head rotation. So actually, we'll go over that in a second. But here's the, actually this is even better. Let's do it this way. That's even better. Okay. So we have the styloid on the left side actually making contact with the atlas. Every time you bring your head down, it's going to rotate your atlas a certain way. It's going to push it back. It's making contact. Maybe it could be argued that that's what's keeping the atlas from going to the left. When we do left and right head rotation, it does move, but when you're in a weight-bearing neutral position, your atlas slides up to the right. And there's actually a few other things going on here. Okay, so here we can see that there is a jugular vein up in there. Inside the cranial vault, you're a little more dominant on the right, but you do have venous drainage as it exits, almost co-dominant. Anyway, then the right one. So we know that the right one is displacing the jugular vein, and there's just a ton of pressure in there. So here we 3D printed it, and you can see basically this is where the jugular vein is going to be. It's going to be tethered here and pulled tight like taffy. It's actually coming out in 2 different locations. So this one, you used to have a normal flow coming out out of there at one point. And then on the right side, so this is actually one of the things we found is not only you're between a rock and a hard place with the styloid, there's a muscle that seems to be injured back in here, and it's displacing the jugular vein anteriorly also. Now the neat thing was, during the physical exam and the treatment, we found that when we went inside your mouth to the back of your throat, on the right side here, it was pathological. Think of it as a neurovascular bundle. When you think of neurovascular bundles, you typically think of the groin, the elbows, the wrists, but this is a choke point too. So when we went in there and tried to check out the terrain there, it's like there was, well, the muscle seemed to have it, both muscles in there, the oblique, the rectus capitis anterior and the lateral one, they both had like muscle contractures in there. The soft tissue seemed to be constricted and tight. Now, what we see a lot is we'll see people that are born with hypermobility, they're on the connective tissue disorder spectrum, and you seem to be very tight, like you were born extra tight. And then when you get in injuries, the contractures, the tightness in here. When we tried to pick you up and elongate you, make you tall, everything went weak, and you're stuck in this slouchy, constricted anterior head posture. Your shortening of the stylohyoid ligaments and other soft tissues are causing you to be in this slouchy type of position. So anyway, when we went in there and took that swollen, boggy, pathological tissue and moved it from medial to lateral, one of the things that happened is that your right arm, which was really weak, you're getting injections for ligamentous compromise in the right shoulder, significant, and both legs were very weak. I would imagine that you're not able to walk very much without getting fatigue. But when we went in there and pushed that displaced neurovascular bundle, all of a sudden the right shoulder, the strength came online, both legs got strong. So is there a dysautonomia? Is there a reflex sympathetic dystrophy going on there because we have a pathology or an injury that was just never healed? Either way. So praying over you, trying to figure out what to do with you. At first thought, it was you're safe removing the right styloid, keep the left styloid in there because, actually come over here for a second. This is where we 3D printed, and the left styloid is totally making contact with the transverse process, the enlarged transverse process that's gotten thicker and wider because it's being inured by some of the muscular attachments. Either way, the styloid is making contact with it. It's kind of held it in there. So the first thought that this was a bony stop, keeping you from going too far anterior, and that maybe we shouldn't remove that. But after talking to you, the reason you're slouching like this is because there's a constrictions, contractures in there. So what do you do with somebody who was born too tight? And being 3 months premature, when we look at your anatomy, there's an extra tightness in here that people don't have. I could even show you the anatomy book. Here we go. So when we look in here, there's space all around here. You've got let's call it out, the rectus lateralis capitis muscle actually displacing your jugular vein. You're not going to see it with this anatomy. And you have the rectus capitis anterior muscle that is also displacing in there. When I went in there and pushed that off of there, one can only suspect that I opened up the jugular just a little bit, took some of the back pressure off. Anyway, it made a big difference to you. I'm still trying to understand exactly why it made such a big difference. But either way, you're born with tight little anatomy in here. Everything is really close. It's not like a typical anatomy book. So I heard one of the doctors say, well, what we have here is an uncommon presentation to a common problem because of this anatomical variant that you have. And that's what we're seeing. People with vascular anomalies or anatomical variants, they have the same kind of injuries that the rest of us have, but they don't present like that. Those were the highlights tailed. I've got some screenshots to run through here to tell the story. Anything you want me to say that I haven't said? Basically, now we're under the thought that both styloids have to come out, and if there's any hypermobility, and by the way, you have no hypermobility on the DMX. Nothing shows hypermobility except for that right shoulder that all the muscles were turned off in. Anyway, so you're tight, you're too tight. When the styloids come out, I'd rather deal with whatever looseness we may or may not have underneath when the styloids come out. I think we're going to be just fine. Let's see here. Yeah, we did just check for other contractures in there. There's that displacement. Yeah, since we did 3 venous phases, we found the jugular vein. Look at that, completely, there's just nothing there. And the soft tissues in there are beat up. That vein is going to be beat up. All the soft tissues are going to just beat up, and when they remove the styloids, it's going to release a lot of stuff. Look how that jugular vein is completely displaced and brought sideways. And yeah, this is going to be a good day. So whatever problems you have from removing the styloids, we'll deal with those. Yeah, we just really kind of did an inventory on your atlas, how it slides back and forth. I don't think we need to get into that too much. I think that's all I want to say. That's all I want your doctors to see is that, well, with right head rotation, your right jugular vein opens up. Left jugular is completely entrapped. Neutral, your left jugular vein is completely entrapped. Left head rotation, both veins open up a little bit. And that's shown when you go to the left, your atlas moves to the right. There's a displacement. It just moves back and forth. So this atlas, I also believe your atlas is stuck more to the right because of this styloid. It's blocking it from, I think you're being blocked from normal motion from not a keloid, but just the way you react either to the injury or you're just born with really tight spaces in there with no margin. I think that's all I want to say, unless you want me to say something else.
I think we got it.
Okay, you can stop it. How many minutes was it?
10.